All right, good morning. Thank you all for coming. We really appreciate it. Welcome to RVNAhealth. We are pleased to have Mike Bush here, who will be providing us with a comprehensive overview of your Medicare options. Whether you're well versed in these programs or just starting to explore, Mike is going to give you some valuable insights in how to address any inquiries that you have. It's important to note that although Mike does represent all of the insurance companies, whether it's your Part D or your prescription or your supplemental or Medicare Advantage, he is here purely as an educator. So he's going to just talk about the pros and cons of Medicare and Medicare Advantage and answer any questions you have. Following his talk, we're going to have a question and answer session. We'll have Mike answering questions. We're also going to have our intake manager behind you, Nora Casella, who can answer any questions you have about start of care here at RVNAhealth. For those of you joining us on Zoom, please utilize the chat to ask any questions, and we will try to get to everything tonight, this morning. Yeah, in my dreams, it's Friday night. Once again, thank you for being here. Mike.
Thank you so much, Pam, and thank you everybody for coming. My name is Mike Bush. Briefly about me, how I got into the Medicare business, because everybody always asks. It is a pretty dry subject, but it's great helping people. So my mom started working for Ed for about 20 years. She's from 8 kids. My dad's from 6. Huge family, friends everywhere. So a real need for Medicare education when people are turning 65 or coming off work coverage. So she started the business. It's grown and grown and just become a really good resource to everybody. So.
In case.
Yeah, everybody can hear me okay?
Get better.
Great. Awesome. So like Kim said, I represent every insurance company every year. I take all the tests, work for ourselves. We're independent brokers, but we do a lot on Medicare education when you're first coming on board. Part of my service also is shopping around for everybody during the fall, during open enrollment, which is this time. If you didn't see every Medicare commercial out there on TV. October 15th to December 7th, I get in touch with you, say, hey, any new doctors, meds, conditions, are you happy with your plan? And do a free review every year during open enrollment to make sure you're still in a good spot. Also during the year, I'll leave my contact info at the end. If you have questions, please reach out, call, text, anything that comes to mind regarding Medicare. So today, the president
a little bit closer to the mic.
Sure, I'll bring it over. Okay.
Yeah, that's right. Thank you.
Okay. This program and the booklet in front of you is put out by UnitedHealthcare. The booklet does not follow this exactly, but same information. Nothing to do with UnitedHealthcare, just I like their stuff for educational materials, so I use that for the basic A, B, C, and D explanation of Medicare. So no plan specifics today, just base-based Medicare. Please feel free to interrupt me with questions. We can have a sort of open forum about your personal situation, or if I go over something that pertains to you, please ask. So what we will cover today is what Medicare is, who can have it, working past 65 in Medicare. That's the #1 question I get, whether it's a spouse working or yourself on a plan. What Medicare covers, just the basic A and B and some other coverage options. The costs of basic Medicare, choosing the Medicare coverage, some enrollment periods and penalties, when you can change every year and on your initial startup, and a couple of money saving tips as well. So first, what is Medicare? Medicare is a federal health insurance program for eligible U.S. citizens and legal residents, funded in part while you pay your taxes. It is all individual health insurance. It's not free, not family-based. There's no group plan, and it is not Medicaid. So Medicaid is state-based. Medicare is federal. It's also not Social Security. So you will get your Parts A and B from Social Security, but you don't have to take your benefits to do so. Social Security does administer the Parts A and B, but they don't have to be in conjunction with your benefits starting taking your check. So Medicaid, this is what you see a lot of the TV commercials aiming at when they say, give me your zip code, this and that. They're looking for lower income beneficiaries. Every state's a little bit different. Connecticut is super generous with their Medicaid program. The limits for next year are about $2,500 a month as a single and about $3,600 a month as a couple filing jointly. If you're under those limits, you have a whole access to a slew of plans that really are zero per month, zero for medical services, and via prescription help with that as well. So who can have Medicare? You have to be a U.S. citizen and legal resident. You must live in the U.S. for at least 5 years in a row, including the 5 years before applying for Medicare. Unless you have end-stage renal disease or disability, 65 is usually the first window everybody has to come on board. You can have ALS or end-stage renal disease. If you're on disability for 2 years, on the 24th month, that will turn into Medicare. So if you're under 65 and on for 2 years, Social Security will actually send you this Medicare card, red, white, and blue, starting your 24th month of disability. So having both Medicare and Medicaid, that's called being dual eligible. Everybody over 65, if you're a citizen and meeting the requisites, qualifies for Medicare. Medicaid is definitely income-based and differs state by state. So the big question, do I need Medicare if I plan to work past 65? A couple rules surrounding this scenario. You may be able to delay, most people can, but the requirements for that is that your employer has more than 20 employees on the plan, and the employer health coverage is considered creditable. So that just means as good as or better than regular Medicare. At 65, when you turn 65, the government wants you to come on board, obviously, and start paying into Medicare right away. You don't have to do that if you carry group coverage or you're covered by a spouse, as long as they have more than 20 employees there. So you can delay it. The only extra step that you have at that point, let's say you're 65, you work 3 years, or spouse's plan working until 68. When you go to Social Security and apply for the Part B, Medicare and Social Security is going to ask for an extra form from your employer, HR, for the current coverage, saying I've had credible coverage from 65 to present. So that's the only extra step, and that helps eliminate any penalties for not going on Medicare right at 65. If the employer has less than 20 employees on the plan, or the coverage is not considered credible, then you have to go on right away. Otherwise, the clock starts ticking on that penalty. And that is a lifetime penalty, so it's not a ton, but it is added to your Part B every month. So you don't want to have any gaps or lapses in coverage. Feel free to reach out to me or anybody informative to help you line up the coverage from employer or spouse's employer with Medicare with no gap. Down the bottom, you see if you're covered by a spouse's employer, and they do have to be an active employee. I just ran into a scenario, not much I haven't seen, but this is something new. If you're on COBRA, if you get COBRA after 65, then they're going to ask you to go on Medicare right away. So while still working, you can have Medicare and your employer insurance. Doesn't always make sense. There's some rules about HSAs, which I'll get into, but you can have Parts A and or Part B in the background of an employer plan. If you take any part of Medicare, you'll no longer be able to contribute to an HSA. So you might know that the Part A is free through Medicare, even if you have the Part A for free in the background. You can't contribute, and neither can your employer, to an HSA account. So if you're delaying and you have an HSA, don't even start the Part A. Otherwise, they're going to do a 6-month look back, which I'll get into, but you're better off contributing to that Part A instead of having it in the background. It could be secondary and pay for some of the hospital, but it's a very specific situation where that would make sense to have over an HSA. Medicare won't cover anybody but you, so consider how the dependents, if anybody on your plan is going to be, if you have a wife or husband or wife who's under 65 or children on the plan, and you go on Medicare, chances are they're not going to be able to keep that work coverage. So those scenarios, I advise you to stay put, especially if you're paying a decent group rate. But at 65, that's the first time you can have Medicare. So I do a lot of review of group benefits to see if it makes sense, and definitely give you an impartial recommendation on both coverages. So what does Medicare cover? Original Medicare, which is the piece you do through Social Security, covers hospital and medical Part B. And you see it says helps to pay for, because there are cost share from you involved. If you just have Parts A and B, hospital insurance is hospital and inpatient, so anything confinement. Part B is anything outpatient, doctor's office visits, anything other than prescriptions for medical. So some things Part A covers: your hospital room and meals, ICU, prescription drugs, anything they do in the hospital, lab tests, x-rays, operating, OR, skilled nursing, blood transfusions, hospice, part-time skilled care, and rehab services after a qualified inpatient hospital stay. Most people get the Part A for no cost. You just have to work for 10 years or 40 quarters and pay into Social Security, which I'm sure most of you have. If you were a homemaker and your husband or wife worked, you can collect off their work history also. So if you don't have work history on the books, but a spouse does, you'll qualify for the free Part A. You cannot be denied coverage as long as you're a citizen that has paid in. Coverage is nationwide, so anytime you're talking about just A and B, that's federal. You can see a cardiologist in Tennessee if you want, if you just have A and B, because they'd be accepting the Medicare network. Also, hospitals and walk-ins nationwide, everybody's going to take basic Medicare. Coverage costs are per benefit period. That just means like you have a hospital deductible for the Part A. If you only had Part A and you go in the hospital, you have about a $1,600 cost. That could reset every 60 days. So most deductibles, they go year to year, but let's say you have a hospital stay in February, and then August, you're going to pay that $1,600 again. And don't be too fixated on the $1,600 because you'll pick either an Advantage plan or a supplement to cover that. But if you just had Part A, that is the deductible for hospital stay. You must be admitted as inpatient, not on observation. This I'm seeing less of after COVID. They were packed with beds. They didn't want to admit you. It still sometimes happens, but if you go to the emergency room or the hospital and say, it's medically necessary that I be here, they might disagree or put you off to the side. They're allowed to keep you pending for about 48 hours. Now, some insurance companies are including that as a copay, but it was a lot of gray area before. Just make sure if you go and they're not admitting you, right on the intake form that it's medically necessary that you be there, then you have a leg to stand on when you talk to the insurance company for the inpatient cost, because they were charging observation fees. They were saying it was to keep the lights on in the hospital, for hospitals. But just be aware of your status in the hospital. Medicare Part A also provides 60 lifetime reserve days. If you use up your annual benefit, you can dip into your lifetime, which is a 60-day thing. So Part B, the other piece, you do pay for the Part B. Part B is doctor's visits, office, annual wellness visits, flu shots, clinical lab tests, blood work, x-rays, MRIs, CAT scans, some health programs like smoking cessation and obesity counseling, PT, OT, speech language, diabetes screening, mental health, any durable medical equipment, wheelchairs, oxygen commodes, prosthetics, and the ambulatory surgery center services. So everything else medical besides prescription is under the Part B. So the amounts for the Part B this year, 2023, the premium is $164.90 a month, going up to $174.70 a month next year. And that can be adjusted for income. If you're over, it's about 100,000 a year next year for income as a single, and about 200 as a couple, they're going to assess a penalty, high income penalty for the Part B. If you think you might be over those limits, write down the acronym IRMAA, IRMAA. That stands for Income Related Medical Adjustment Amount. And there's about 6 different levels, depending on where your income falls, where you're going to have a graded load to that Part B amount. And with that, they're going to do a 2-year look back. So if you were going to start Medicare A and B and pick a plan for January 1st, they're going to look at your 2022 tax returns. I do a lot of doctors and pediatricians that, stop working, the income changes drastically, you're under that limit. There is a form that you can forego that 2-year wait, so you're not paying penalty.
What is the limit?
About 100,000 as a single and 200 as a couple.
Okay.
2-year look back for that. And those limits go up a little bit every year, but IRMAA, there's a ton of info on it. It's good to be there, but just be aware you're not going to pay the 170 or 70 like everybody else.
Does that change as your income changes?
Does that what?
Does it change or in fixed forever?
No, so they're going to do a 2-year look back. So
Every year?
Yep, every year. So if you have income change or drop off, then you can contact me, or there's a form that says it's a life event. You stop working or change in wages, but you don't want to pay 2 years worth of penalty if you're a high earner and then go down to a regular or lower income. By the other side of the coin, there is a way to have the Part B paid for. Those limits I gave you for the Medicaid is in regards to the MSP, it's called Medicare Savings Program. Under $2,900 a month as a single and $4,000 as a couple, the Part B will be paid for. Those other limits I gave you are for full dual status. But about 2,900 as a single, 4,000 as a couple. If you make less than that, then Connecticut will pick up your Part B, and some prescription help comes with that as well. Connecticut doesn't look at assets right now. They're very generous with the program. So if you think you're around there, they're not going to look at house, bank account, 401, unless you're drawing off it for income. But no assets, only income as of right now, and that's administered through DSS. So some gaps. So now let's say you have your A and B in place, you have your hospital and medical, but now you need prescription coverage. You don't have an out-of-pocket max under the Part A and B, and you're paying about 20% of everything, 20%, 80% split, very common on Medicare. Medicare is going to pay 80, you will pay 20%. This is just if you're on A and B. So it won't cover all the costs of your care. You do have cost share along the way with A and B. You need to add a prescription drug program of some kind. Does not include routine dental, vision, or hearing, which is crazy to me. I think eyes, teeth, and ears are part of the body, but they are wear and tear items from an insurance standpoint, so I do understand that. Eyeglass, contacts, or hearing aids, no extras on basic Medicare. They will cover like a cataract or surgical procedure, but no extras for frames, lenses, or eye doc visits. Long-term care. Definitely need a long-term care policy or arrangement if you're in the hospital over 90 days. Excess charges by services for doctors who do not accept Medicare assignments. So that means if you see a doctor that doesn't accept Medicare, which is rare, but bills Medicare, then you could pay a percentage above and beyond the top of the bill. Very rare. Just make sure if you're seeing a provider that they accept Medicare. I do see some, Fairfield County, there's some concierge doctors that take nothing. They say, pay me for the year, I'll come to the house, and they just don't deal with Medicare or insurance at all. Also, care received outside the US. Some plans have a small emergency benefit, but if you're traveling abroad, I recommend travel insurance and getting back as soon as possible if something's seriously wrong. So getting more coverage. This is actually on page 7 in the booklet. If you want to turn to that, good page to take notes. So you'll see on there, step 1 is your Medicare Part A and B. That's done through Social Security, and I can help you line up timing with that, whether it's 65 or coming off work coverage. And then you have 2 options to fill in those gaps for drug coverage and to protect your out-of-pocket max for the year. 2 options, lots of different companies and plan choices on each side, but 2 structures of how the plans are offered. You can only have one, you can change every year. Option 1 is a Medicare supplement plan or Medigap. If you've heard those terms before, those are one and the same. These are paying your 20% in Medicare to the tune of, could be $175, $200. There's a couple different plans with letter designation under the Medigap side. And then you have a totally separate plan for your prescriptions. So you'd have 3 cards under the setup. You have your red, white, and blue A and B card that pays first. Supplement plan fills in the gaps, and I'll get into the actual plan benefits of those because they are federally regulated. They don't change every year. And then totally separate plan for your prescriptions. So option 1, you have no network because Medicare is primary. You can see anybody that accepts Medicare. Option 2 is a little bit different. Option 2 is everything you get in the mail, see on TV, all the $0 per month, dental, vision, hearing. They're all legitimate plans. But the difference here is you're paying, let's say, $0 per month. I use the 0 plans as an example. Nothing per month with an out-of-pocket max. So let's say you're paying nothing per month for your care, besides that $174 for the Part B, you're always going to pay that. But nothing in addition to that, $0 per month, and then you have co-pays for everything you do. So it's more of a pay-as-you-go setup rather than paying per month and having more covered, if not everything, under option 1. Option 2, some people like, especially when you first turn 65 or come on board, you say, I only go to the doctors once or twice a year. They're going to cover you well on that side, but if you have a bad year or a lot of medical events during the year, you have an out-of-pocket max that you could hit. Let's say it's usually $6,000 to $7,000, depending on the plan. Some are more, some are less. But you look at option 1 and say, okay, I could pay $200 a month, and that kind of caps my exposure and cost for the year, especially if you're going through treatments for something, or if you're snowbird, you have a residence somewhere else and want a network, 5 months out of the year, see doctors in Florida or wherever you go. The Advantage plans are going to be network based. So they're going to be HMO, PPO, Usually PPO is the way to go if you're going to look at the Advantage side, but nothing per month or very little per month. Some plans do charge a premium, but then you have co-pays for everything you do up to that 7,000 or so out-of-pocket limit. When I was first learning, I said, how could you have a plan that doesn't cost you anything monthly? So for each month that you're on one of these plans, whether it's Aetna, Anthem, Care Partners, whoever, they get paid about $1,000 a month from the Medicare Social Security pool just to have you on the plan. So they say, great, we're getting 12,000 a person per year. Most people don't use that. Some people use $500,000 a year, but everything in their risk pool is offset, and you just have co-pays along the way. So they're going to give you some extras. They want you to be healthy. The less you require, the less they're going to pay out on your behalf. So gym membership could be over-the-counter benefit, a little bit of dental, vision, and hearing. You do get some extras on the Advantage side.
What does over the counter mean? I mean, because I'm just thinking in my head. When
Yep.
I was working, if there was like a list.
Yep, there is a list. Each company has an approved list. So like, for example, you might get 75 a quarter at CVS for over-the-counter items. Could be toothpaste, Band-Aids, nasal spray, stuff you might be buying anyway. It's a whole list and free money from the insurance company. So definitely take advantage of that if your plan has it. Yes.
Tell me to talk about this later, but what happens if somebody chooses the Advantage in the beginning and then 5 years into it wants to go back to the original Medicare?
Yes, so that's allowed, especially in Connecticut. Some states have a little bit stricter rules. Connecticut is guaranteed issue state. So as long as you're in an approved time during the year, like the fall or, coming off work coverage,
They can't deny coverage because of.
can't deny, they're not going to do age rated, they're going to do a look back on pre-X. You can jump back and forth every year. I have some people that do the Advantage for 3 years and then say, hey, I can do cataracts in the hip and do it all in 1 year on the supplement side, if you can plan it like that.
Mhm.
And strategize that way and then jump back to the Advantage after that.
But Connecticut's more of an exception than.
Right.
Okay.
Some states are, there's information going around that you can't, you pick one for life and that's it, but no, that's not true.
Okay. Thank you.
Questions in the back ones? Yes.
Mike, I think a good time just to plug in here, if you discuss qualifying events that might allow someone who's on a Medicare Advantage plan, either in error, we've had experiences where elderly patients have switched to a Medicare Advantage plan and been unaware of it. But then have a qualifying event inside a year that allows them to make a change.
Sure. So we do go over that at the end. But yes, there's a few times during the year, if you have like a chronic condition or change in income, change in address, incarceration. So a couple different special election periods that give you 63 days to jump on something else. But yes, I'll definitely go over enrollment periods. Yes.
So I heard somewhere, and I don't sure not to answer the question. If you take Medicare Advantage and you're on it for more than a year, and now I decide I'm going to get replaced, I'm going to go on straight Medicare during the enrollment period, and now I need a supplemental. I've heard that you now have to pass a medical exam to get your supplemental.
No.
That's not in Connecticut.
Definitely incorrect. Yeah. Not in Connecticut.
Not in Connecticut,
Yeah.
right? In other states, maybe.
Maybe I haven't. I'm only based in Connecticut. I can find out. We have a huge network of agents nationwide, but Connecticut's pretty lenient. Did something right on the insurance side. So, yes.
The Medicare plan, it doesn't cover dental, vision, and prescription drugs.
Sure.
What do we do about that?
So prescription drug, if you do the option 1 Medigap setup, there's about 20 different prescription drug plans available to you. So if we plug in your meds, we use Medicare.gov to shop around, shows me all plans. So you'll have a separate rider for drugs, separate card, could be United, it could be whoever, just for pharmacy. Dental, vision, and hearing. Dental's like the number one question I get. I use something called dentalplans.com, believe it or not. It's a great discount plan. Not every dentist takes it, but I pay $200 a year for my fiance and I, and then we pay a discounted rate every time we go. So worth checking out. There's also Delta Dental. Anthem has a great extras program. If you like the traditional, where you pay $50 a month and then get your preventive stuff covered at $0. But ask your dentist also what they accept or offer. Because a lot of dentists now are doing in-house programs. So it's worth it. Sometimes they'll say, pay me $200 for the year. I'll give you preventive at no cost, and then 30% if you need anything major. Vision, there's not a whole lot out there for vision. If your doctor accepts Medicare, your eye doc, then you can see him under the Medicare, each side, Medicare Advantage or Medicare supplement. But as far as the tests and the glasses, things like that, No coverage for that under just basic Medicare.
Okay, thank you.
I've heard that the Advantage plans are quite good if you're quite healthy. And, the difficulty of going from an Advantage, it's difficult, tell me if this is true, to go from an Advantage plan back to the,
Original Medicare with
original.
supplement. Yep, so you can do that as long as you're in an approved time during the year. They actually gave you 12 months of a free look period if you're on Advantage for the first time. They won't tell you about that, but you could jump back in the first year. No test required after that. But as long as you're, October 15th to December 7th, or the first 3 months of the year they give you also, then you can jump back, no problem. And yes, they tell me not to market the Advantage plans as healthy plans, but it's true. If you're betting on your health a little more if you're going with the zero plan, because you're saving that monthly money and then paying co-pays as they come up.
So do most of the Advantage plans pay for the premium and the copay, or one or the other or none?
So every company offers a 0 per month Advantage plan, but it's all going to be co-pays. You might pay 0 for a preventive visit or primary, but once you get into tests or hospital or anything, then the more serious, the more you're going to pay out of pocket. And that's 6,000 to 7,000. You're not going to hit that in one shot, even if it's a 2-week hospital stay. You have a copay in place for that. That 7,000 is just a maximum of all your medical copays added up for the year, for protection for you. If you had a bad year, then you don't pay anything after that. 7,000 out of pocket.
Is the copay the same copay no matter where you go? Is it always?
No, all companies are different. Each service is different. All specialists would be the same, if you group them like that. But no, it's important to shop around to see what you specifically need it for. Yes.
So when you go on Medicare Advantage for your first 3 months, as you mentioned, like your trial period, so to speak, get your contact lenses, your glasses for the year paid for, and then hop off.
You can. I'll actually strategic like that. I don't know. Yep. My cousin just joined us and he did that for somebody recently. He's like, yeah, use the dental benefit with them for the first 2 months.
Exactly.
Switch to somebody else.
You have your dental cleaning, get your glasses, get your contact lenses, whatever you do, wear, and
Yep. They're not sticklers about the extra benefits, really. Yep. You could absolutely do that.
You just have to remember to hop off.
Yep.
Or they have good reminders.
Okay, any other questions on this slide or the options?
In chat,
What's that?
in chat,
In chat, it says, when retired through TRB, which plan do you recommend? Medicare Advantage PPO plan or senior supplement plan?
I'd have to take a look at the exact benefits for that. Usually, if you're asking me black and white, I'm recommending supplement every time, just because, yeah, you're not going to get a little bit of dental, vision, and hearing, but you're going to pay a set cost monthly, have no network, and then if something comes up, barely any, if any, cost share. The blanket recommendation, I'm going to recommend supplement every time. It's just ease of access with facilities, and no network.
Medigap, in other words. Medigap.
Medigap, Medicare supplement, yep, those are one and the same.
One other question is, what
I'm
was the
sorry,
website?
you mind repeating the TRV explanation, please?
I think they're having a hard time hearing.
Okay, so yes, I always recommend the Medicare, the Medigap, Medicare supplement option over the Advantage. Some people love the Advantage and say I'm healthy or I don't have anything scheduled and I'll, keep a lower monthly cost for myself. But Medicare supplement, if you're asking for a blanket recommendation, I always say supplement because there's no real network, just Medicare, yes or no, and they're going to cover more when you go to use it.
So pay more, but it's better benefits, better coverage.
More per month, less when you go, and the Advantage is the opposite usually.
Thank you.
Sure.
And another question was, what was the website to find dental plans?
Dentalplans.com, believe it or not. Great resource. You can find your dentist. If you're flexible on a dentist, you can look for the discount plans. Fun tip there, if you're enrolling during a holiday, they usually give you like 20 or 30% off your yearly, so try to time it like that. No enrollment period for the dental usually of any kind. So if you're going to join a dental or vision plan, try to do it a month before your appointment. You don't want to pay for half a year and then have it come off then. So just a tip there. Dentalplans.com. Also, if you search Anthem Extras, is a little bit more traditional dental vision option. Right. So Part C, Medicare Advantage, I touched on most of this. Another way to get your Medicare benefits, an alternative to Parts A and B. So your A and B are actually wrapped into that Advantage plan, and that's called Part C. So Medicare prescription drug coverage, whether it's by itself or part of the Advantage, is Part D. Think D for drug. That's your drug piece. So you pick either C, Medicare Advantage, or the option 1, Medigap, Medicare Supplement. Under the A and B, you have the C, you're still in the Medicare program. So I had a guy who was on Aetna. He's like, great, I plan $0 per month. I'm not going to pay the Part B premium. Well, everything went away for him. So no matter what, yes, there's 0, but you still have to fund Parts A and B because they're wrapped into that plan. Yes.
This is what you don't recommend.
I don't not recommend it. But if you come to me and say, hey, I'm going through stage 3 cancer treatments, this wouldn't make sense to you at all. It would still cover you, but your exposure's 2 or 2.5 times what you definitely pay for the year on the other side. And quick note about the Part B, if you're collecting Social Security, then they will send you your Parts A and B automatically a couple months before you turn 65. So just be aware of that. Some people don't want to start and they're collecting. They'll send it to you right in the mail and they'll start taking that Part B right out of your monthly without you approving it or anything because they think you want to be on it. If you're going to delay it and you're on Social Security and that Medicare card comes in the mail, you just send it back and that'll delay your start date until you contact Social Security and want to set up the Part B to start. Also, if you're collecting that Social Security, they'll take the Part B right out of your check monthly. If you're not, because you don't have to take Social Security to start Medicare, but if you're not collecting, Social Security will bill you quarterly until you start collecting, and then they'll take it out.
Can you back up here? Are you saying this is an opt-out program, not an opt-in program?
What's that?
Are you saying it's an opt-out program, not an opt-in?
If you're collecting Social Security, they'll enroll you for the first of your 65th.
Only you're collecting Social
Right. Yeah. Another question back there?
So I'm just trying to understand kind of the differences. So are you saying with the Medicare Advantage plan, rather than paying the providers, they pay, like the government pays
Page
insurance
26.
company to then pay the providers?
The government is actually not even involved at that point. Well, they pay the $1,000 a month to the insurance company, but they're not part of claims or anything because that private company is administering all the benefits and claims. So that's why the federal government gives them that $1,000 a month. They say, we don't want to deal with this person, or, now that private company is in charge of your claims, deal with you, but,
So basically that means insurance companies have more of a say in what they're gonna approve or not approve, or
Oh,
what
yeah.
they're gonna pay or not pay.
there's more red tape on the Advantage for sure. Yeah, prior auth sometimes. Referrals, I don't see a ton of that anymore, but for procedures or skilled nursing, sometimes it can be a pain.
Okay.
So, yeah, so one issue that I had, so a friend of mine, he had an issue from, and needed to go into a facility. And they couldn't get her into a facility because the facility wasn't taking that Advantage patients. Does that happen?
So that happens. You do have to be in network. Everything's network based on the Advantage side. But no Med Advantage patients at all. I don't know if I've heard that, but very
No,
possible.
but no, they.
Just that plan?
I don't know, it's unusual.
It's possible, but to be that exclusive, I'm surprised. But
Now,
Medicare,
just say to her, switch her to Medicare, and you'll be fine, and then they take her on Medicare.
oh yeah, that's usually the answer. Yep.
So real quick, an employer funded Medicare Advantage plan, they're the ones who are actually controlling what you're allowed to get, right?
Yes.
Versus me going out
Into
and
the
getting it.
marketplace, right.
myself, right?
Yep. So employers, I just had that with somebody last night who had that
I
option.
have that.
Yep, they had either an employer-based supplement or Advantage, no choices on each side. They were pretty good and discounted, but I always look at everything just to, if you have a summary of benefits for a retiree plan or something like that, I look at it because I'm not going to advise you move, and then 3 months later you call me and say, oh, I can't get back on that. Why'd you do that? So, but yeah, if you have a retiree benefit, usually you can't get back on, or a 2-year waiting period or something like that. So just be aware.
Yeah. Okay.
Question from Zoom. If you have a Connect card that fills in coverage after the supplemental, should you not switch to an Advantage plan?
So if you're on the Connect card, that's the gray card from the state of Connecticut. That's if you're under the 2,500 a month as a single, 36 as a couple. That's Medicaid benefits without being on full spend down. So there's a couple different levels for the extra help there. That gray card through DSS, you get the energy assistance through it, food stamps, all goes through that. But what's the Medicare piece to that is the Medicare savings program. So that if you're on one of those, there's actually plans for people with that card. You kind of get the best of both worlds. You pay nothing per month. They are Advantage plans, but then you get, that's the 2,000-3,000 worth of dental you see on TV. 0 per month, 0 per hospital. The whole book is pretty much 0 besides the extra benefits. So you can stay on just A, B with the Connect card. And if you have that set up, usually DSS is going to enroll you in a standalone drug plan to cover your meds. Because even if you're getting prescription help, you need your plan to cover the med for that extra help to come through. That's a big piece. So yeah, you can stay on that, but then you're giving your gray card to everybody. They have to accept Medicaid as a provider in order for that gray card or Connecticut to pay. Yes.
Sorry, sorry. This is like last-
No, questions are
No,
great.
You had said before that, Med Advantage, that the insurance company makes a decision versus the government on straight Medicare makes a decision. So if I'm in the hospital with a knee replacement, is there a difference between how many days I'm allowed to stay in the hospital based on if I'm on straight Medicare versus what the insurance company decides?
Just depends what they're gonna pay. I mean, if you're medically necessary to be in there, then yes, your Advantage plan is gonna have like a per day hospital copay. But it's just up to the facility really if they're gonna take the Advantage plan.
And does that, what about number of those rehab visits? Is there a difference between the two, or is it standard?
Advantage is gonna cap you at like 90 days or 100 days in skilled nursing.
What rehab is that?
Like they're not gonna pay at all after 90, 100 days.
But that's straight Medicare, what?
Medicare, you can dip into like your lifetime reserve days. Usually you can just put everything through the A and the B and they pay for it all for skilled nursing. Yes.
Back to the other question, if you have the Medicare and Medicaid as well with the gray card. So you can go on to the Advantage plans
Oh, yeah.
with that, or no? 'Cause-
Yep.
oh,
So if you go on a regular Advantage plan, sometimes the doctors will still bill you the assigned copay. But then you give them the gray card and that covers all copays and deductibles.
okay.
But if you're going on an Advantage with that gray card, you're gonna want to do a decent plan. It's called dual special needs. And that just means Medicare, Medicaid, health.
Mhm.
Okay, any other questions on Advantage? Covered all of that. So all Advantage plans cover A and B. You're not going to lose anything by going with the Part C plan. Most come with a prescription drug coverage wrapped in. So same plan like you have now, one card for doctors, hospital, pharmacy. That's how the Advantage plans work. There are some plans that don't cover prescription drugs. I have some people that do everything either at the VA or went without drug coverage for years and don't want to start it, but still want the medical piece. So lots of different scenarios there, but most have that drug wrapped in. So if you see an MAPD, that just means Medicare Advantage prescription drug. There are MA only, which is the option without the drug right. And again, you get some extras over here. They make everything very enticing on the Advantage plans, and they're good. So if you never use it, you're saving monthly money. Take advantage of the extra benefits. Aetna's doing something next year, $1,200 reimbursement for golf greens fees, national park fees, fitness tracker. It's $1,200 a person. I like it because they're getting paid on your behalf. It's nice to see some of that money come back to you, and they're supporting active lifestyle, which is healthy. Yes.
Yeah, I understand with Medicare Advantage, you have the A and the B. How does the drug part work if I'm not paying any annual and I'm not paying any monthly? When I go in and I get the drugs, I pay the discount, I pay the copay for the drugs just like A and B.
Just like A and B, if you put it through the standalone drug plan on that side, you're just paying monthly for that plan. You have to add it to yourself. So on both sides, you're going to pay copay at the pharmacy. Some meds are no cost, but you have copay for every med. On the Advantage side, it's all wrapped in. So you're not paying monthly for the drug coverage, but you give them your card at the pharmacy just like now and say that prescription drug piece is included.
So is that generally more than under the GAP plan on the copays?
They're pretty close. Usually you decide medically which side you want to look at, and I can shop everybody, but very rarely does an Advantage drug cover, better than all the standalone ones on that side. They're pretty close. Generics are very low across the board. Once you get into like Eliquis and Xarelto, the expensive brand name meds and donut hole, chug it into, then they're pretty similar.
Thanks.
Yeah, worth looking around. Even if nothing changes on your end every year, the drug coverage change, co-pays change, network changes on the Part C side, so definitely worth looking.
I know one time for the drug, I had to work with an insurance company for my dad to get one of his medications actually approved. It was covered tier the year before, the upcoming year, they had taken it off the tier. So it was really difficult. Is it still that difficult to get?
Did it
Things
come out
that
of coverage mid-year? Did it change mid-year or just the whole year wasn't covered?
No, the whole year. It was like they changed, when they do all the
They chop,
changes,
right?
yeah,
Yep.
they chopped that one.
Okay.
And he had been on it and it worked and, they wanted him to do other things, but they had to prove obviously that he
Yep.
tried those before, so.
Right.
But is it still that type of jumping through hoops if you've been on something and the plan chooses to chop the med?
It could be. I mean, I look at everything else, whether it's with our Canadian
Mhm.
pharmacy, patient assistance programs. But that's why you shop around every year. So usually the insurance company will send you something in the fall saying this med's going to be covered at a tier 4 next year or not at all.
They did, and my dad had a stroke and
Okay.
I just sort of got thrown into all of this, so.
So usually in that scenario, you can ask for a formulary exception.
Mhm.
So you call them and say, hey, he's stuck on this plan all year now. Can you cover it till the end of the year to a time when we can change to somebody else? So usually if you're asking and really doing an appeal, they'll cover it. Not all the time, but say squeaky wheel gets the oil. So
Right.
they do want to help you, the insurance companies, and they don't want
That's
their
why.
salaries to go down.
That's why I'm here. My dad's no longer with us, but my husband is now on this, so.
He's lucky to have it.
Thanks.
Yes.
Can you tell me a little bit about the medical savings account plan there? It's just like what we have today before retirement, where you make a certain amount of money put in that account, reduce your income, but you have to use that during the year or you lose it. Is that?
Yep, like an FSA or an HSA. Yep, they're all savings
Because
accounts.
the HSA you can carry over. Yeah.
Right.
Yes, but the NSA doesn't.
Right.
Okay.
The most common you'll see plan types wise is HMO and PPO. SNP, that's if you're either a chronic condition, institutionalized, or Medicare, Medicaid eligible. Those SNP plans designation, those aren't for everybody. You have to have one of the qualifying conditions or income level. But HMO and PPO, just so you know the difference, PPO, you have a network. If you were to see doctors outside the network, then the PPO is still going to pay a portion. If you're on an HMO and go out of network, you're going to be billed 100%. There's no out of network coverage at all. So PPO, usually the way to go over an HMO. HMOs aren't bad if you say, hey, I have one doctor, most are going to cover every hospital and walk in anyway in an emergency situation. But if you want flexibility of network, PPO gives you a little more benefit. So again, Part C must be enrolled in Part A and B and live in the plan service area. They used to be very county-based. Now they're getting better about being state-based. Can't be denied coverage based on current financial or health status, including pre-existing conditions. You may be required to use provider and pharmacy networks, definitely provider networks. Now we're seeing a lot of pharmacy contracts get stronger and like CVS bought Aetna, so it really depends where you go for your meds. Coverage and costs vary by plan and can change every year. A lot of them are pretty consistent, especially the big national carriers, but co-pays change, drug levels change, doctors come in and out of network. It's important to look. Yes.
You mentioned a couple of times in Medicare Advantage, when you're describing it, you can't be denied coverage. Can you be denied coverage in Medicare?
Regular Medicare?
Yeah.
No.
Oh, so what's the significance of that statement?
You're to denied if you were to get on during the year or apply during you had a broken back that you're working on or something like that. They're not going to look back and say, nope, we're not going to cover you. You have pre-existing condition.
Medicare will do that?
No.
Oh, so then you say the same thing for Medicare.
They just let you know either what they're not going to exclude you.
So nobody's going to deny coverage on pages.
Right. Unless you're outside of an enrollment period.
Right.
Right. Okay, so annual limit on out-of-pocket costs, they range from like 4,800 to 9,500. They may charge a monthly plan premium. Every company, I believe every company that offers a Medicare Advantage in Connecticut does offer a 0 per month plan. Those are very competitive and you do get some great benefits, but there could be a monthly premium. And can't stress enough, have to continue paying that Part B amount to Social Security to keep your Medicare Advantage plan intact. So Part D, again, D for drug, 2 ways to have the coverage. 1, as a part of the Medicare Advantage plan, and 2, the standalone option if you go with the Medigap. So Part D plans cover types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. So each company has to cover 2 meds in each therapeutic category. So if you're on, and it's July, you're on a plan, you're in lock-in, can't change your plan, and you get prescribed something that the insurance plan does not cover, they have to cover 2 similar meds, or we can do, like we talked about, formulary exception. And sometimes there's step therapy, which means that the doctor prescribes you a couple other meds to try it. So most of the time, there's going to be another option, whether it's brand or generic, if the one that you're prescribed is not covered. Every plan does have a formulary. That's a list of covered drugs. And also Part D covers commercially available vaccines not covered by Part B. Every drug has a tier designation. So some plans actually have 6 tiers now. Tiers 1 and 2 are usually generic meds, 3 and 4 are brand, and 5 is specialty. They go up as the tier level goes up. Usually tier 1 and 2 are brand, or excuse me, generic, but there could be generic meds covered at a tier 3 or 4 level. It's a brand new med to, like when Crestor went generic for 2 years, they covered it at a tier 3, even though it was a generic. So usually the older the med, the cheaper it gets. Yes.
How do you know if the medication you're on, what tier it is?
So I do all the shopping through Medicare.gov. You can look at each company's specific formulary, but you just put in a list of your meds, zip code, pharmacy, and then it sorts them by cost for all your meds if you got everything monthly for the year.
Okay.
You could be on a tier 2 1 year, could go to a tier 4 the following year. No change on you, but that's when the insurance company notifies you and you shop around during this time in the fall. Yes.
For those who haven't done it recently, if you input your list of prescriptions, you can use that to try out every plan that's available and it's going to tell you all the monthly cost, the whole radio cost.
It shows you when you're going to hit the donut hole. That's what I use to shop for everybody. So you see every company.
What is that website?
Medicare.gov.
Medicare.gov.
Yep. There's almost too much information on there, but it's a great resource. So speaking of the donut hole, who has heard that term, the coverage gap? Not the good kind of donut hole. So there's a couple of different drug phases throughout the year. You could pay a different amount for the same medication, depending on what time of year it is and how much you've paid out already. So there is a deductible. Not all plans have a drug deductible, but if they do, you would fund that first. Then you go into your initial coverage stage, which is the negotiated copay amount. So I use the example, let's say I'm only taking an inhaler. Let's say retail cost from that inhaler is $800 a month. I'm not paying that $800, I'm paying $50 copay. So in my initial coverage, I'm paying that $50, $50, $50 every month that I need it. They're adding up that $800, even though I'm not paying it, that retail cost every month. These are 2023 numbers. 2024 is going to be about 5,000, it's 5,030 in the initial coverage, and then the coverage gap is 8,000. So I'm paying the 50 a month. They're adding up the 800. Once that 800 sum reaches 5,000, then I slide over into the coverage gap. During the coverage gap, you're paying 25% of the brand name, of the retail cost, rather than that $50 copay. So now that inhaler goes to a $200 copay monthly instead of 50. So some meds, there's just no avoiding the donut hole. It's worth it to shop around. Pharmacy makes a huge difference. But if you're on a brand or certain injectables, creams even, then those are the expensive ones, and they're counting that retail cost every month. So usually around August to October is when that number crosses the 5,000, and the end of the year is more expensive.
Why do they do that?
So they only want the plan, no matter which plan you're on, because this exists on every Medicare plan, they're only going to pay out a certain amount. If you're on all generics or cheap meds, you're never going to even come close to that. And they say, great, you don't need a huge cost to them. But they want you to have a little bit more skin in the game after they put out 5,000. And that 5,000 and 8,000, that's not totally out of your pocket. That's the insurance kicks in, drug manufacturer actually kicks in a little bit, and whatever you paid for co-pays. So once you go over the 8,000, then you pay usually nothing or a very, very small amount through the rest of the year. So I have some people on some like infusions, they pay 3,300 in January, and then the rest of the year is no cost.
So the
Depends.
catastrophic coverage, like, meet your out of pocket max,
What's up?
where you talk about catastrophic, that's like, you've met your out of pocket maximum.
Just about, yeah, there's not, it doesn't totally shut you off. But most of the time it's zero if you're spending a ton. It's really a percentage of the med or zero, depending on the medication, but it's pennies on the dollar after you're out of the donut hole. And that does reset every year. So if you're coming on mid-year, try to be strategic with that. If you have some expensive meds, because employee coverage for meds is different than what's available on Medicare. So to have Part D, you must be enrolled in Part A, D, or both. You may be required to use a pharmacy network. Usually you can go wherever you want, but in-network is going to be better than, preferred is going to be better than out-of-network pharmacies. Coverage and costs vary by plan and may change each year. There is a Part D premium penalty for late enrollment. So for example, I had a 92-year-old woman, never took a med in her life, now she needs meds. So they're going to look back to 2006 is when the Part D came out, and penalize her for each month that she didn't have coverage. That only happens if you go to get on. Some people say, forget it, I don't want to pay a penalty, I'll just use GoodRx or, but sometimes there's no getting around it and you need to put it through the plan, otherwise it's crazy expensive. So they do a look back, they determine the penalty. It's usually about $3 a year that you didn't go on, added to your monthly premium for the Part B, Part D, whatever that is. If it's wrapped into a zero plan, then they just add it to zero and you're paying a premium penalty, but that is lifetime. Because I get not wanting to go on a drug plan if you have nothing, or if you're on cheap generics, but there's plans out there for 50 cents a month next year. So always worth it to have something, one, to avoid the penalty, and two, you don't know what's going to happen mid-year. It is worth it to have some coverage for the drug. It's more about the Medi gaps, going back to the option one. So again, A and B are primary. Medigap pays your 20%, and then you have your Part D separate. Can't be used to pay Medicare Advantage costs, pretty self-explanatory. You can only have Medicare Supplement or Advantage. You can change back and forth, but can't have both at the same time. There are 10 plans standardized by federal and state law. Not everybody offers every plan. I'll go over the chart, I believe it's the next slide. They are plan letters, so they were nice enough to name the Medigap plans, Plan A, Plan B, and so on, just like Part A, Part B. But all of those Medigap plans have a letter designation. Plans with the same letter offer the same basic benefits nationwide. Massachusetts, Minnesota, and Wisconsin, a little bit different, but most people, most plans, excuse me, if you're on Plan N, it's going to be federally regulated benefits. But it is important to shop around carriers for those, because yes, all Plan Ns are identical, but one company might charge $200 a month for it, one might charge $450. Same exact plan. And they are offered by private insurance companies. Yes, they're following the A and the B, and they are regulated, but they're offered by AARP, Blue Cross. Those private companies still offer the Medicare supplement. So they may pay, they do pay for Part A hospital coinsurance, Part A skilled nursing, Part B coinsurance or copay, so anything inpatient or outpatient. Cost of blood transfusion, the first 3 pints, cost for 365 extra hospital days. Hospice care, Part B deductible, Part A, foreign travel, and provider charges above Medicare's approved amount. So this is the supplement chart. You may have seen this before. If you've seen it anywhere, it's exactly the same, no matter where you're looking at it. In the book, I believe this is page 27.
28.
28, 29. Okay.
Yeah.
Okay, so the supplement plans, you see the C and the F are set to the side there. They're actually discontinuing the C and the F unless you were on Medicare before January 1st, 2020. You see Plan F pays everything all the way down. Federal government just doesn't want a plan that pays 100% of everything, so they're phasing out the F. You don't have to keep it to be grandfathered in. You could always jump back and forth if you started before January 1st, 2020. But if you're after that, then they are not going to let you on to the C and the F. Plans A and B are really for people that are under 65. If you're on Medicare with disability, they don't let you have access to all of them.
What plans were those?
A and B and C. So A, B, C, not worth it to go on at all if you're over 65.
Over.
Yeah. You can only have those if you want a Medicare supplement option under 65. The two that I recommend on this setup would be the Plan G and the Plan N. Plan G is kind of like the new Plan F. It's actually better because of the way the monthly costs fall. But you see Plan G is the most comprehensive available plan now. Those premiums are usually $220 to $260 a month, depending on the company. They're doing some rate increases for next year. But that's the most expensive supplement that I would recommend. You see it pays for everything 100% all the way down, except for foreign travel. No one's going to cover you 100% out of the country. Except for that one box, you see the Part B annual deductible. So if I'm on a Plan G, I pay $260 a month. The Part B deductible next year is $240. So once I fund that $240, then I don't have any cost share for the rest of the year. Could be a doctor's office appointment, could be a week in the hospital, surgery, ambulance, no bills at all. These are good if you have a ton of office appointments, surgeries, visits, chemo, treatment ongoing for anything. Because then you're worrying about your care more and not bills coming in. You just pay that flat monthly. The Plan N, I think, is the best value plan. Those are $175 to $200.
Then like the area,
And like Nancy. And the Plan N is very similar to the G. You still have that Part B deductible, so $240. And then you see the little asterisk next to the 100% for the copays. So after that $240 is paid, you pay up to $20 for office visits, whether that's primary or specialist, and up to $50 for ER. Everything else is covered 100%. The only other box that's not billed there is the excess charges. So on the Plan N, if you saw somebody that didn't accept Medicare but billed Medicare, that's when you could pay a percentage of the bill above the top. Yes.
Which one do you recommend for those over 65?
Usually the N, unless you're going to the doctor, weekly or a couple of times a week, or really going for heavy treatments for something. A lot of my people don't even get the bills for that $20 for office visits, but you could pay up to $20 for each office visit.
What about Plan G? What about Plan G?
So Plan G takes care of those copays, but it's an extra $30 or $40 a month.
So if you see the doctor a lot, Plan G.
You'd have to see him a lot. But some people like that, and they say, I don't want any copays. I'll just pay the monthly one-time deductible, and then I don't want any bills coming in. So
what is the copay on Plan G?
up on G, no copay on G.
I mean, the monthly.
Monthly is $230 to $260. Everybody's increasing a little bit. But
Would be cheap if you are tallying up what you see someone frequently, that includes all specialties.
Right.
Okay, so
Yeah, primary specialist, any office visit is going to be no more than 20. But if you're doing that, let's say every single week, then it makes sense to go with the G and not have the copays at all. It's just the max allowable amount that the doctor can pass along to you. It could be $3 visit, it could be 17, but no more than.
I mean, give you an example, if I had knee surgery and I had to go to PT like 3 times a week.
Yep.
That.
Up to 20 per visit.
Okay, so by being on G, I'm still better off.
Yeah, especially if you're doing PT.
Okay, something like that adds up.
Yep. There are some other supplements. I don't usually look at anything less than the N. I think, if you're paying half the hospital deductible, there's just a lot of piecing together. You can certainly do that, but if you look less than an N, then I say maybe look at the Medicare Advantage option. So Medigap Fast Facts must be enrolled in A and B and live in the state where your plan is offered. Usually, like I have a lot of people move to Florida. If you have a Connecticut-based supplement plan, you can usually keep that in the state that you're moving to. They'll have you pick a new drug piece because you have to be within your plan's service area or county for the drug part. But the supplements are by state, so like Florida's rates are pretty high for supplements. So you may want to keep your Connecticut medical piece if that's your scenario. No medical underwriting up to 6 months after enrolling in Part B at age 65 or older. Again, if you're in an approved period during the year, they're not going to look back at all. Nationwide coverage and no provider network, you just ask Medicare yes or no. Guaranteed renewable as long as you pay your premium. So even if they're phasing out these plans or plan goes away, you can always have the letter designation that you signed up with as long as you're paying your monthly premium. Plan premiums vary for the same coverage, absolutely, and the coverage is identical. So you want to make sure you're in a plan that is reasonable monthly because they're all doing the same thing. Plans with more coverage generally have higher premiums. You pay more per month, less when you go, and you must continue to pay for that Part B to Social Security. So how much does Medicare cost? A couple of buzzwords here you might be familiar with. Premium is the amount that you pay for your coverage, usually billed monthly. Deductible is what you pay first before insurance kicks in at all. Copay is a fixed amount you pay at the time you receive a covered service, and co-insurance, just like a copay, but usually it's a percentage. Usually 80-20 split, very common one you see on the Medicare side. So a couple of costs that you might pay if you're on each type of plan. The Advantage is going to have a low to zero monthly premium. You might have deductibles, co-pays, or co-insurance, depending on the service. Part D will be no cost if it's wrapped into your Medicare Advantage plan. If it's on the supplement side, you'll pay a monthly premium. Some have a deductible. Usually the deductible on Part D plans only applies to brand name meds. So even if your plan has a deductible, you might pay nothing or very little for the generics and never even reach the deductible. And co-insurance, that's pretty rare also. Usually have a flat dollar amount for your medication. Some of the more expensive ones will have a percentage attached to it. And the supplement side, you're paying a monthly premium, maybe that $240 Part B deductible. And then on the end or plans like that, you would have the $20 and $50 copays. So how do you choose? Everybody's different. I have couples, one does Advantage, one does supplement. It's all individual, so everybody's different. And it is a yearly decision. So there's no one size fits all. We look around every fall. I take a list of your doc's meds, conditions, and give an unbiased look of what's out there. Lots of different combinations that you can have here. You could just have your A and B. You could just have your A, B, and a Part D drug plan. That's common for people with the gray card, at least when you're first starting out. You could have Part A and B with a Medigap and no drug coverage. Don't advise that. I would say the next option is the most common for the Medigap. That's A, B, standalone drug coverage, and the Medigap plan. The Part C, the top one is a Medicare Advantage only. Again, not including the drug coverage. The second one with the Part C coverage wrapped in, Part D coverage. So the second one is the most common there, Medicare Advantage prescription drug. And the Part C, you could have a Medicare Advantage plan if it doesn't have the drug and add a drug piece. I don't think I've ever seen that. So really, I don't like the slide at all, but there's lots of different combinations that you could have. Two are the most common. So here's that chart to go over these steps. Again, A and B is done through Social Security first. Then you pick another coverage option after that.
That's slide in the book.
Yeah.
What's that?
It's the beginning.
Sorry, I didn't hear.
That's slide in the book.
In the book, yes. Yes, page 7.
Yes.
So Medigap or Medicare Advantage, just some tips to choose which side works for you. Medigap pays some coverage costs not paid by original Medicare. That's picking up your 20%. Does not help with drug coverage costs. That's what you have the extra plan for. It is nationwide. No network on that side, just Medicare, yes or no. May offer additional value added services. Usually they don't. Usually they're giving you like a gym membership, silver sneakers, or Renew Active, but nothing as far as dental, vision, and hearing. The cost for the Medigap, you're going to pay monthly, and for a drug plan. And the out-of-pocket costs depend on the plan you choose. So a lot of repetitive info here, but breaks it down for you on which side would be recommended for you. Medigap's definitely more convenient if you're traveling or want the ease of no network. The Advantage, providing the benefits beyond Parts A and B, often includes the drug coverage. You're definitely going to have a provider network on the Advantage side with some additional benefits, dental, vision, hearing, over the counter, gym membership, all of that. So cost may charge a plan premium for the Medicare Advantage, some are zero. Often that drug coverage is wrapped in. You'll pay co-pays and co-insurance for most services. Again, a lot of the preventive is no cost. I will touch on one part of preventive. It's the only gray area that I see, and it's on every insurance, not just Medicare. If you go in for colonoscopy and they're looking at either family history or your history, or they find polyps, then they're going to be billed as diagnostic, and that falls under outpatient. So if it's preventive and they're not looking for anything, it's just a routine screening and they don't find anything, then it'll be no cost. If they find something, great, and hopefully they take care of it. But then you're going to be billed outpatient, so that could be a $0 to a $800 or $1,200 even bill. So be aware of what they're looking for. If you're on a zero plan and you do preventive, great. You know you're going to have some things, or if they're looking, that's a consideration. Maybe you do a Medigap.
So that can happen if you're on Med Advantage.
Yes,
If you're on Med Advantage and you gotta have your 5-year colonoscopy and they don't find anything, doesn't cost you
no
anything.
cost.
If you're on Med Advantage and they find something, now you're out.
They're going to bill the outpatient, could be $395, $495. If it has a deductible, it's even more, because that's looked at the same as an outpatient surgery.
They can't find anything unless you have colonoscopy.
I hate that rule. Some plans are starting to put a, zero for diagnostic or preventive, but still that's some gray area. Yes,
So just to remind you, sorry, with Medicare, dental, vision, hearing, it's all, you just have to completely go shop in the marketplace. Like
Yes.
nothing.
nothing on A and B.
There's no part anything for those.
No, they're talking about, they talked about it for a couple of years now. I wouldn't hold our breaths, but Congress was like, oh, maybe we'll do a blanket benefit and give everybody $800 card for dental vision. It's a very broken system, but it's dental and vision is not regulated like the medical. So dentists are charging pretty much whatever they want, and that's the expensive stuff as you get older.
What is the overall healthcare plan that Congress has?
That Congress has,
Yeah, the secret plan and that's everything.
I don't have access to those. I know they're probably phenomenal. But yes, they're making decisions not based off their own needs. Yes.
What, we've been recommended to use via benefits. Do you have any comment on that?
For,
To choose?
for like a broker or somebody.
Yeah.
Yeah, as long as you're working with somebody that looks at every insurance company, then as long as they're going to give you an unbiased recommendation, because I see all the time, people just want to get them, get a commission or something like that. They're going to
Okay,
recommend something for them. I look at everything and say, I'm not going to say, oh, I get paid on Aetna, but Medicare is better for them. So you just never run into that. You don't want to have somebody that does. A lot of investment places, they'll say we do Medicare, but they only offer one or two companies. So just be aware of somebody biased. Yes.
Do you buy like BSP or IMED, or does that have to be an employee that?
Nope, you can buy that.
You can buy those as
Yep,
well?
you can have those separate. Also, a great tip is if your spouse is working or you still have access to work benefits for dental and vision and hearing, you can keep that piece separate. So even if you're going on Medicare, usually the dental and vision. What's that?
Like Cobra for those?
No, just your dental and vision. So let's say you're on the group plan with the dental and vision, you could go on Medicare and still keep the dental and vision separate. And those are usually $8 to $15 a month instead of $40, $50 on the Medicare side. So
Not once you spouse or yourself stop. Oh, I think that's not budget.
okay, some enrollment periods. The initial one is when you turn 65. You have 7 months, 3 months before and 3 months after your birth month. So for example, I'm born May 8th. The earliest I could get on Medicare would be May 1st, but I could apply for it anytime during February, March, or April. Only exception to this is if you're born on the 1st of the month, they give you the whole previous month. Yes,
So the kid of your age there, is 3 months, is the 8, or can you apply within?
nope, the 1st of the month. So your Medicare card is always going to say the 1st of some month, for the parts A and B. So like on the 8th, they're going to give me the 1st of May, and I have the 3 months before that to apply for a May 1st start date. If you wait until after, you still have those 3 months on the tail end, but then there might be a waiting period depending on which coverage you choose. So I recommend lining it up, well ahead of time. But anytime in those 3 months before your birth month, you'll contact Social Security and say, hey, I want my A and B to start, and then you pick the month. Again, they're gonna send it to you automatically if you're collecting social security. People throw it away all the time and get billed for months in the background. They have no idea. So just a lot of stuff comes in the mail, especially this time of year. Make sure you don't get an envelope from social security with your Medicare card in, and that would start everything. So if you miss your initial period and you're not coming off work coverage and you just went without, you said, I'm 65 and I'm gonna be self-pay. They give you the first 3 months of the year to sign up for A and B, and then the second quarter to add an actual plan. So if you sign up during January, February, or March for part A and B, they make it effective July 1st. They have you wait until after the year's over. All the while you're accumulating that penalty. So during the second 3 months, they say, okay, you have your A and B in place, now we'll let you join secondary coverage. The last 2 years, actually, they eased up on this a little bit. I wouldn't count on it, but they let everybody get on right away at January or February start date. But this is usually the rule for general enrollment. If you miss it, works a little bit differently for the supplement open enrollment. If you're age 65 and let's say it's 4 months after your birth month, you can still get on a Medicare supplement. So they give you 6 months after to jump on your initial enrollment of 65. No medical underwriting if you enroll during this time. You can apply at other times, but outside that 6 months after, they could deny it or start to look back.
That's the gap. If you decide to go on plus gap.
Yes,
So the Medicare, they can deny it?
if you're past that 6 month window. So that's an approved time during the year. Connecticut's guaranteed issued, but you got to be either surrounding your 65th birthday or in the fall, October 15th to December 7th. It's not any time of year that you can get on without look backs, but they give you a couple extra months in the tail end. Or
Why would they deny it?
What's that?
Why would they deny it?
That then they can look at pre-ex.
Medicare, not Medicare, Medicare.
Right.
But what if you don't want to apply for Medicare at 65 and you're still working and you're putting in plan, this, that, the other thing?
Then you don't have to do anything until you're ready to come off that coverage.
But
But
when you're ready to come off and you do apply, then you can't get Medicare. So
Nope. You kept that coverage in place the whole time. This is if you had no coverage at all.
Oh.
So if you carry work coverage, they're gonna,
First, you're 70 and you have your 40-back plan that qualifies this, that, and then you apply, then you get Medicare without being here.
Right.
Without being denied.
And the same for Part B, you don't have to elect Part B until you do the work.
right, and that's when that comes into effect, where you have that extra form, employer or HR fills it out, and that eliminates that 5-year look back and penalties, because you did have credible coverage. Most coverage is credible. I have run into like 2 people over the years that kept it, thought it was credible, and then they go to get on and they say, nope, that didn't meet Medicare's minimum requirements. So in a delay past 65, talk to your benefits coordinator and make sure that it's credible. Again, most are, but just double check that's the only due diligence you have to do if you're going to delay.
Michael, what's the time period between, so let's say you retire at age 67 in June, how long do you have to sign up for Medicare?
63 days, they give you 2 months after. You can do it before to line up, when you're leaving. But after those 2 months, really, you have to follow the general enrollment period. So working past 65, if you delay your enrollment with credible employer health coverage, you'll have 8 months to enroll in Part A, Part B, or both. So they will give you 8 months after getting on, but only 2 months to get on an actual plan. So 8 months to get on regular A and B of Medicare, but if you wait for month, 3, 4, 5, and so on, then you can't pick an actual plan. You only have the first 2 months to enroll in Part C or Part D, if that 63-day window. Just make sure you're lining it up or doing it in the first 2 months. So yes, you can do A and B and it'll stop the penalty for that. But as far as other coverage, if you don't sign up for at least drug coverage right away, then that penalty clock starts ticking also. Any questions in the chat? Good, checking.
No, they are asking if they can receive a copy of the presentation via Zoom, that they were attended via Zoom.
Absolutely. Okay, so late enrollment penalties for Part A and B, none if you qualify for either the free penalty under Part A, which most people do. None if you're qualified for special enrollment, like I said, those few times during the year. Otherwise, it's 10% of the Part A and B premiums. And again, those are lifetime penalties. Part D is that 63-day window, whether you're leaving group coverage or a spouse's group coverage. Penalty for the Part D is 1% of the average Part D premium, which changes every year, so there's no way to really estimate it, but I'd say about $2 to $3 for every year that you don't go without you do go without the Part D coverage
That $2 per month, $2 every year.
per year. The $2 to $3 will be assessed monthly. So every year that, right,
So if I miss 10, so if I don't do it for 10 years, that's $30. My
A month.
index $30 a month for
Right.
the rest of my life.
everything revolves around the Part D coverage. It's all big pharma prescription read. So right now we're in the open enrollment period. This is when the gates are open. I'm slammed. I'm like an accountant in the fall, October 15th to December 7th. During this time, you can do whatever you want, go from Advantage to Supplement, Advantage to a different Advantage. You could put in 10 different applications. The last one you put in for December 7th goes into effect January 1st. I'll say most people don't change during this time. They're happy with what they have. The goal isn't to move you, but at least we double check it and give it our blessing, make sure there's no surprises for the new year. But you could do whatever you want. If you keep your current plan and do nothing, then it'll automatically renew for the following year. So no actions required. You don't have to sign anything every year if you're going to stay put. But just be aware, all the benefits are still appropriate for you. The plan still exists. The doctors are still in. If you have a network, that's the time to change. A couple years ago, 2019, they came out with the open enrollment period. So right now is the annual election period, AEP. I call it open enrollment, but technically the first 3 months are called the open enrollment period now. First quarter of the year, if you're on one of those option 2 Medicare Advantage plans, then you can make a one-time change. If you're on straight Medicare with a supplement, this doesn't apply to you, but if you're on the option 2, you can change either to a different Advantage plan, drop it all together, and go with the Medicare supplement option. Reasons for doing this, let's say you're on a 0 plan, you're healthy, everything's great. February rolls around and you say, okay, I have a cancer diagnosis. I always use cancer just because it's expensive. If you're on one of those plans, you're going to hit your $6,000 to $7,000 out-of-pocket max at some point. It's just an expensive journey. So you say, okay, I'll drop it, pay $200 a month, or pick one of those, plan N, plan G, and then I'm capping my costs. So you're protecting yourself instead of hitting that $6,000 to $7,000 out-of-pocket limit. You have a Medicare supplement in place, and you're just paying a monthly. You don't need anything bad to happen or a qualifying event. You could just move if you're unhappy or see a benefit somewhere else, or a doctor comes out of network. But that's the time to do so after open enrollment in the first 3 months of the year. Yes.
Just to double check on your previous answer. So in Connecticut, that is fine, but in other states, that could
Nope,
not?
this exists everywhere now.
Everywhere.
Yep.
So, okay, so they basically there's a safe harbor there for people that find some bad news that they can, during this time of the year, switch back to a more favorable plan.
Right. Some people will say, oh, I might have results of a test coming up, but I have the appointment first week of January. So then, we can reassess then. It just gives you a little bit more flexibility rather than being in lock-in for the rest of the year.
Well, go for the full year, then you die. That's the point, right?
Right. Hopefully not that. Okay, special enrollment period. So qualifying events, moving, leaving retiree for group coverage. They give you 63 days for 2 months. That. Did you get the picture?
Yeah. Thank you.
Couple money saving tips. Using your preventive services, again, on the Advantage plan, they're going to be covered, except for that colonoscopy, physicals, mammograms, no cost for those. Using your plan's provider network, if you have a network on the HMO or PPO plans. Ask about generic and low tier prescription meds. I look at every way to save money on meds. I know not everybody can take generic ones, but that's always going to be cheaper. Using plans preferred pharmacy or mail order. Mail order is great. I know we're New England, so I say if it's just pills, then great, send it through the mail. They'll give you 90-day supply. But if it's a temperature sensitive thing like creams, inhaler, insulin, maybe go fill that pharmacy. And lastly, understanding your status in the hospital. Make sure they don't stick you in observation, and if you that, make sure you're admitted if you think it's medically necessary and getting the care that you need. Some financial assistance programs. Connecticut's DSS for everything. Medicaid provides healthcare coverage for people with limited incomes. They all vary by state. Medicare Savings Program, which again is that piece for the Gray card, the Connect card. And the PACE program of all-inclusive care for the elderly provides care services for frail elderly living in the community. Where you can go for help, MedicareMadeClear.com, that is put out by United Healthcare. Kind of mirrors this presentation, great educational resources. That's why I like them for the seminars and basics of Medicare. They're going to want you to sign up for their newsletter. Anytime you see AARP also on the Medicare side, that's United Healthcare. So they contract together. There are some good articles. They have Medicare Education Week every year, Facebook and YouTube. Medicare.gov is the spot for any kind of info. 1-800-Medicare. You can call them if you need a new Medicare card. It's a lot easier than calling Social Security. They're still a little slammed this time of year, but great alternative for waiting on hold 2 hours of Social Security.
Can you go back to the slide if you
Sure.
don't mind?
Oh,
I just need to take a picture of it.
sure.
Appreciate it.
That's in the book too, isn't it?
Yes, right at the end, these last few. And Social Security. So for signing up for A and B, you can go down to the office. I usually recommend that if you have the time, because then you can talk about benefits also. You can do it online on ssa.gov. The website for the extra help for Connecticut is connect.ct.gov. So CONNECT.ct.gov. And that's DSS site. You go on and make a username, you go on the portal, and you can apply for all the benefits through there. But all the extra help that I talked about today is the Medicare Savings Program. Also, I have applications for that because the paper apps are a little bit easier. Might take you a week or two longer to hear back. But they ask for less online. They're asking total household. They ask for assets, even though they don't hold them against you. So if you want a streamlined application in paper, I'd be happy to send that to you. I think that is it for today. I'll take questions. Good, everybody coming? Yes.
Question devil's advocate to put out there, two scenarios, the moving except. Does that mean temporarily moving, or do you have sold your house and moving to a different?
Yes, the address change wherever you're doing 6 months in a day, they do it off your primary address.
So what I would put out there and what I've seen here is circumstances where something might happen to you where you need to move in with a family member, a child who's maybe in a neighboring state. So if that patient has a Medicare Advantage plan in Connecticut and moves to New York and Jersey, wherever, to stay with their child for a month to get care, wants to see a doctor in their child's state, wants to get physical therapy in their child's state, they no longer have coverage. Is that correct?
Correct. They would have to pick something in their new area. I had somebody move a county over and the Advantage plan wasn't offered there, so they had to pick a new plan.
Would they pick the plan in that scenario?
Oh, yeah, they get 60 days.
Okay, so that is considered a move.
Correct. Your current plan will cover you 2 months unless you change sooner. But they give you a window for sure if you're changing address.
And
Well, what if that changing address, but if really, so what if I have a hip replacement and I'm just going to live with a child for 6 weeks?
Nope,
Right.
you're on the same
Right,
plan.
and
And if they're in New Jersey, then that might.
That's what I'm
Then I
talking
can't get
about.
PT in Jersey. I can't, so I really can't go live with my child if I'm Medicare Advantage?
Advantage, you could go, but then you're gonna pay out of network for.
that was the scenario I was presenting, that I'm
Yep.
not moving just temporarily and live there so a kid can take care of me, but I need physical therapy in their state, see a doctor in their state. That would not be covered. Because you brought it up about hospital stays and being mindful of hospital stays. It also happens if you're in the hospital in observation, not admitted, and they recommend you go to a skilled nursing facility. You're then gonna be on the hook for that skilled nursing. facility.
You need a qualified
You
hospital
need
stay
a
first.
qualified hospital stay for
Usually
3
3
days
days.
before you go to the skilled nursing facility. So being aware of your status, we often get calls saying, I just want to let you know, mom's been admitted to the hospital.
Yep.
It's my job to call the hospital and say, this patient, oh no, they're in observation. And they've stayed in observation for 3 or 4 days. And are then going to the skilled nursing facility. The family then finds out a week later, they have to pay for the skilled nursing facility. So please, everyone, be very mindful of your status.
So speak up if you're in there. Milk it for the extra day. But yes,
I have a question about choosing an insurance broker. Are the brokers paid by the customers or by the insurance companies?
Good
If
question.
by the insurance companies, how can you make sure that they're giving you unbiased advice?
sure. So they all have to pay the same. That's what that's really talking about it. So I'm a free resource. I do a ton of education, never cost for my service, whether it's this or one-on-one. But I get paid directly by the insurance company. So if you're on Medicare Advantage plan and I move you to a different one, you're getting paid the same next year because you're still my client. So it doesn't matter, you know, if I have your best interest in mind. I'm not getting spiffs from many companies. They're not allowed to pay any differently. But I do get paid directly if I place business with Medicare.
And if you place in straight Medicare, you get paid if I buy my supplemental and my part
Sure,
D
plan.
from you. So you're not biased one or the other. You do what's best for the client.
And are there brokers who only work with certain
Most, I would say.
insurance companies?
Yep, that's called being captive, or like I take the test, it takes me 2 weeks every September to take the test for the fall for anybody you could have in Connecticut. So I make sure I represent everybody, and you can see it all on Medicare.gov. But yeah, if you're not going to me, make sure you're using somebody that is impartial and isn't charging you, because I do see some educational seminars of people that offer guidance and are charging for it, which they're not supposed to. They're getting paid anyway, but not everybody follows the rules.
How would you find out if the broker is captive?
Ask them what they offer.
Oh, okay.
A lot of them will be like, hey, I work for Aetna, and then they're only going to talk about it. But an independent broker is really the phrase you're looking for. But even them, not all the time are going to contract with everybody out there.
So are there any plans in Connecticut that you do not represent?
I want to go back to the other question, that for, the observation and the admittance and not being covered going forward. Is that also under the Medigap or just the Advantage?
That's everywhere.
Everyone.
Yes.
So here at RVNA, we are obviously dealing with patients with more complicated health scenarios. So would you recommend for those particular patients who are in and out of the hospital, especially in and out of skilled nursing, and or needing multiple episodes of home care throughout the year, that they would be better served through traditional medical?
Absolutely. Yep. Yes.
Quick question about the HSA, before somebody signs up for Medicare. So there is like a 6 month look back.
Yes. So the HSA, they're going to do a 6-month look back if you don't stop contributions. If you come right on board Medicare at 65, great. They're not going to do any look back. If you delay our A and B enrollment and are on an HSA, then they're going to tax you 6 months in arrears.
So let me understand that. So HSA, let's say the annual that I can put in is $8,000. Okay, so I can put $8,000 up to the point of signing up for.
If you're going to do it right at 65,
Yeah,
then they won't do a look back.
okay. But
So if you're after 65, not everybody plans like this, but you're supposed to stop contributions 6 months ahead of time. So if you say, okay, I'm retiring the end of the year, stop contributions June 30th.
But they don't prorate or anything like that. You just say, because it could fully fund the thing in the beginning of the year, and then you
Right.
say, okay.
Right.
So the look back is only if somebody is signed up.
After you're 65 window.
Thank you.
Question.
I think another one. So if you want to travel internationally, and so if you're on straight Medicare, you get like N supplement. Right, and yes,
Sure.
and now I can travel. If I have Medicare Advantage, I need to buy travel insurance.
I recommend both getting travel insurance because Medicare supplement, the provider overseas or wherever you are, is going to have to bill Medicare for that 80% to apply. Like I had my dad, he's on Medicare, and he went to the hospital in Italy for 5 days. Medicare didn't really pay anything. He had travel insurance, paid like $400.
Really? No, why did Medicare not pay anything really?
The providers didn't know how to bill Medicare. It's a hassle chasing that down.
Oh, that's
It's
interesting.
language barrier, yeah, it says 80%, but I don't bet on that at all.
So anytime you
Sometimes-
travel internationally, it's beneficial. to
Sometimes
get
you
insurance.
also have to pay before you leave the country. They don't let you leave the country. Okay.
It's a hassle getting it done in the country. I
Yeah,
had
honestly,
this
it's still
happen.
better, but
Had an ad, yeah. I ended up doing all the paperwork just so Pennsylvania could get paid through the state.
stay personally in Alaska for an hour and a half. They didn't want to build Connecticut.
Yep.
Which you're supposed to have, walk-ins and ER nationwide.
Right.
They didn't want to.
What is,
I had to pay it, and it's $7,000 for an hour and a half.
and then you resubmitted it to,
Yeah, but I'm on Access Health, so I have an $8,000 deductible anyway.
There you go.
It's coverage, but it's garbage. We're a small group. We look at group plans and it's me, my mom, her child, friend, and my cousin just joined us. So didn't make sense to do a group plan. So we do the Access Health, which is good. If you're under a certain amount for income, they give you a little supplement for your monthly. I don't get that, but it's a great program. A lot of people get care that wouldn't otherwise have it. All right, any other questions?
Thank you.
No problem.
Very helpful.
I appreciate everything coming.
Thank you. Have a good day.
No, all over the state. I can come wherever. I do like in person for the first one or two, and then we can do by phone if you're comfortable, but I like.
Thank you. We're all straightened out.
Yeah, pretty much for what I need to do.
Five questions.
Well,
Well, this, yeah, yeah. It's terrible.
Yeah,
They
yeah,
don't
and
even
you
look
know,
at you.
you got it, they don't.
And then